New videos every day.
Psyche Truth. Life. Wisdom.
Hello everybody, this is Dr. Echols again, and I'm really glad to be back with you guys. I haven't got to make a video in a little while, so it's always nice. And before we get started, I wanted to thank all of you guys who are subscribing to the video channels where you can see these videos. It's really great to know that there's people out there that are really interested in what we're doing. And today, we're very fortunate to have Corey again with us. And today we're going to talk a little bit about knees. Knees are, important. I don't know what you do without them. But a lot of people damage their knees when they don't really have to. And today we're going to show how we can go about checking to find out if your knee is stable or not, and then how we can go about correcting it. Now, a lot of times people will go out and they'll run on knees that aren't very stable. And when that happens, the knee is just kind of floating around in space. And as it does that, it starts grinding and wearing out the little structures in the knees, the meniscus, the different ligaments, the muscles, and it can eventually end up causing a lot of knee problems. And I might add, and a lot of you runners might take exception to this, but even in the best of circumstances, running on your knees, they're probably good for about 25 years, and that's about it. Running is really, really hard on your knees. If you're wanting to do exercise and stuff, a lot of people just love to run, and they're going to run no matter what. But if you're thinking about taking up exercise and you want to get healthy, I would really recommend something a little less strenuous on the knees. Something like bicycling, actually good for your knees. It keeps that fluid going through the knees, and it's very easy on them. Any kind of thing that's not impactful is very good. Bicycling, swimming, walking is really great too. Even in the best of situations, we're seeing more and more knee replacements having to come across the surgeon's table, just simply because people are putting so much strain on their knees and wearing them out. And it's very interesting to note that, when I was a kid many years ago, you never saw anybody running. As a matter of fact, this is like the first time in history that running is actually considered, a recreational activity or a sport. Nobody ever did that before. But now it's a billion-dollar industry, selling shoes and everything else to help people run better. And with that has come a whole host of injuries and, like I said, knee replacements and that kind of thing. So some people are going to run no matter what. I help them to do that. But if you're just getting into exercise, like I said, bicycling, swimming, any kind of aerobic activity that's not going to be so pounding on those knees over and over is going to be real good. So we're going to check Cora's knees today and just see if we can find any kind of weakness there. And then I'll show you how we can go about strengthening them so that eventually she won't end up having any problems either. All right, so here we are. We got Cora on the table, and we are going to check one of the muscles that is the basic stabilizer of the muscle of the knee. This isn't the muscle that necessarily moves the knee. This is one of the muscles that provides stabilization to the knee. Another thing that happens is there's so much sensory and nervous feedback from these muscles to the brain, and it tells the brain where the joint is so that doesn't have any injury. If you've ever tried to, you didn't know there was one more step there, and you took that extra step and thinking there wasn't there, you almost broke your back when you stepped. Well, that's called proprioception, and that's one of the things that this muscle provides back to the brain, is to tell the body where the knee is in space and time. So we're going to check this muscle. It's called the popliteus or the popliteus muscle, however you prefer. And I'll show you how we do the muscle test on that. And it's safe for you to do this at home if you'd like to as well. Now, she told me recently that she fell off a turnip truck, was it? Yeah. Some kind of truck. She fell off of it and hit her knee right there. So we'll be checking this to make sure that it's okay there. And so let me show you how we do the test on the popliteus. Okay, so we're going to be testing the popliteus muscle of the knee, and we're going to use the foot as a lever to do it. So I'm holding the foot just like this, and I'm stabilizing on the heel here, and I'm going to have you maintain your position here. I'm going to be pushing the foot out this way. Everybody can see that. I'm pushing the foot out this way. You don't let me do that. Push in real hard, and the foot goes out pretty easily. Okay, so when we start doing the adjustments, we'll come back and we'll check this foot to make sure that the adjustments and everything we did to strengthen this muscle actually worked. That way, when you leave the office, you already know it's fixed. Let's go ahead and demonstrate with this one here as well. And on this one, we're also going to turn the foot in. We're going to grab the foot by the right underneath the big toe there while we're stabilizing the heel. And I'm going to push out. You keep your foot there. Go ahead, push. And with this one, I really can't even budge it. Guys, this is a strong muscle. It's very strong. It stabilizes that knee, and you should not be able to really overpower it. I mean, I guess you could if you just put maybe everything you had into it, but it's actually very difficult. It's a very strong muscle. So if you can move that muscle like you saw me do on this foot, we know that there's some weakness there, and that she is going to have knee problems with this eventually if we don't get it corrected. So let's go ahead and do this one more time. Push here, and that just pulls right out. So the next thing we'll do is we'll show you how to go about correcting this muscle, and then we'll retest it and make sure that we have some strength. Now, we use applied kinesiology, which is a form of muscle testing, to do this, and let me show you how we're going to go about doing it. Cora, we'll just get you to put your arms straight up like this. Push right here. Good. And she's got a good strong muscle there. And we're going to reach right back. There's a point on her head that actually corresponds to this muscle. Push right here. Okay. And that is showing up as one of the first things that we'll need to treat. Now, this point that I just have checked, this is called a neurovascular point. And it's going to correspond to the insertion of this muscle. And it's going to be right here on the lateral part of this bone, right here on the outside of the knee. Now let me know, is that the tender spot? Yeah. So they'll tell you. They'll say, oh yeah, it's tender right there. So we're going to just kind of hold these points for just a minute. All right, so I've got a point here that I'm holding on the base of her skull here, and we've got this is where the muscle originates, or where it starts, and she told me that was pretty tender. So we're going to hold these points until I can actually feel a pulsation start there. And it's interesting to note that when I feel the pulsations is about the time that if I asked Cora if that was tender anymore, she would probably say no, it's actually not very tender anymore. Is it still tender? Okay, so it's getting better. We're going to hold it just a minute longer. Good. Now, one of the other points that we'll check, push right here for me. This is called a neurolymphatic point, and it is actually located on the back side of her, about right here. Push here. And this point is actually weak as well. So we're going to hold here with this, and then this muscle wraps around the knee. That's one of the reasons it stabilizes it, and it hooks up over here. And she's wincing a little bit because that's pretty tender right there. So this is where that muscle inserts, is right down here. So we'll hold these points. And remember that the whole point of doing this is just to provide the knee some stabilization so that it doesn't wear out. You know, a lot of people do not realize this, but you've got discs in your knee just like you've got discs in your back and in your neck. A disc is a piece of cartilage. It provides a spacer and a little bit of cushion in there for the joint. And you've got one on both the inside and the outside of your knee. And if the knee is not stable, it's going to be gliding around and making movements that are not supposed to be like that. And it can actually tear those meniscus in there. I actually had that happen. It's not much fun at all. And I've seen a lot of people that have had that happen too. So hopefully we can avoid a lot of this by just checking this muscle, stabilizing the knee, and reducing a lot of the wear and tear that the knee gets on it. How's that feeling? Is that still pretty tender?
Pretty tender, but still longer.
Okay, better, but still tender. We'll hold it just a little bit longer. I also want to make a comment real quick. How about that this knee muscle right here, the popliteus muscle, also has an organ that it relates to. And it's the gallbladder. And the gallbladder is on the right side of the body, right up under the rib cage, and it kind of goes right up on top of the liver. And it's what holds the bile that is essential for your fat digestion and digestion period. So oftentimes when we see the popliteus muscle weak on both sides, we know that there's a gallbladder problem. When it's on one side, maybe not so much. And hers was just on one side. Okay, so we've got that one done. We'll check a couple of more points here. Push. There's the BOR. And then L5 and 4. L5. Push here. Okay, push. So she has also a vertebra in her back, one of the bones in the back, that is actually out of place. This nerve that goes from this vertebra goes down and innervates this knee here. So she has a problem with that. So in order to fix this completely and correctly, we would need to adjust your back as well. So let's get you set up for that, and I'll show everybody how we would do that. So I want you to go ahead and roll onto your stomach for me. Okay, so I'm going to have her push her legs straight out this way. Push out for me. Good. And there it's weak. Push. Okay, so we're going to adjust this vertebra on this side, and I'll show you how we go about doing that. If you want to go ahead and roll toward me this way on your side for me, Cora. Yep, facing me. Now this is the part you don't want to do at home. Okay, it's all right to test a muscle at home, but this is the part that takes a lot of training, and you don't want to really do this unless you are a chiropractor. I'm going to have you lean over a little bit. There you go. This is the vertebra here, and this vertebra is actually shifted or rotated in her spine. And when that happens, it causes neurological problems like she's having here. The nerve isn't working, it's causing the muscle not to work. So we're just going to get in here and gently relax your back there for me all the way. I got you. I'm not going to drop you. There we go. Just a nice little push like that. Lay back on your back for me. Very nice. Let's just go back through some of these points and make sure that they're all holding the way we want them to. Very good. Okay, so now we're going to go recheck the muscle and see if we've got it strengthened up. If it's not strong, then we'll go back and recheck some of the points, see if we missed anything. If it is, she's done. So again, we're going to recheck the muscle to make sure that what we did fixed it. So we're going to grab the foot here, stabilize the heel, and you keep your foot in and don't let me push it out. And it's very, very difficult. She's very, very strong at that point. So to make sure that it's done, we actually tap the muscle. If the muscle isn't completely fixed, this will actually weaken the muscle. If it is, the muscle will stay strong. Okay, push in for me and hold. And I can't move it now. So very good. So what we've actually done here is we've found a muscle in Cora's knee that was actually weak, and it was causing some knee instability. She wasn't really even having any knee problems. This is something that we just found on a screening that we did. But I can guarantee you, if we'd have left that there, down the road a piece, she would have started having knee problems. And she told me already that she has knee problems in your family, right? Your mom has got knee problems, and so she's kind of concerned. And it's a good thing that she doesn't go out and run on this knee, because it would actually accelerate that problem. It would be like pouring gasoline on a fire, right? So I hope this has been some help to you. Take care of your knees. You know, knee replacement surgery is not a lot of fun. You want to take care of those knees. Ask your chiropractor to check this and see if he can help you if you have some knee instability. If you'd like more information, feel free to look up on my website, jeffechols.com. And if we can help you in any way, please let us know. And until next time, have a good one. Bye.